Have you ever really stopped to think about what happens when you're put under for surgery? It's one of those amazing medical things that millions of us experience, but how many of us actually know what's going on? Well, let's dive in and pull back the curtain on the world of anesthesia.
Really, it all boils down to this one simple question. How is it possible for doctors to do these incredibly complex, invasive procedures while we feel, well, nothing at all? The answer, it turns out, is a fascinating and carefully controlled science.
So here's our game plan. We're going to start with the absolute basics of what anesthesia is. Then we'll get into the three main types, looking at them based on how much of the body they affect. And to wrap it all up, we'll see how anesthesia's job often keeps going long after the surgery is over.
All right, let's kick things off at square one. Before we get into all the different kinds, what is anesthesia, really? What's its fundamental purpose?
Okay, so the textbook definition is pretty straightforward. It's a treatment to stop you from feeling pain during something like surgery. Simple enough, right? But to make that actually happen, it has to do two very different things at the exact same time. See, anesthesia is really a two-part harmony. The first part is the one we all think of, blocking those pain signals from ever reaching your brain. But just as crucial is the second part, muscle relaxation. This is what stops any accidental twitches or movements, giving the surgeon a perfectly still canvas to work on safely.
Okay, first up, let's talk about the big one, general anesthesia. This is probably what pops into your head when you hear the word, the whole experience of going to sleep for a major operation.
And the key word here is unconscious. Your brain is put into this deep, controlled, and totally reversible state. You're not just taking a nap. You're in a place where you won't feel a thing, see a thing, or remember a single moment of the procedure.
So how does it work? Well, it affects your entire system, usually through an IV or an inhaled gas. It's what puts you in that deep, sleep-like state and makes sure every single muscle is completely relaxed. This is absolutely essential for those really big surgeries, like open heart or brain operations.
All right, now let's do a complete 180 and jump to the total opposite end of the spectrum. We're going from the whole body down to one tiny targeted spot. We're talking about local anesthesia. And this is the wild part, right? With local anesthesia, you are wide awake. You can be chatting with the doctor while they work. It just blocks the nerve signals in one specific little area, so right there, at that one spot, you feel absolutely nothing. You've probably experienced this yourself, right? Like getting a mole removed, or maybe getting a couple of stitches. It's perfect for those minor things on the surface of the skin where you don't need your whole body to be relaxed. A quick injection, the area goes numb, and you're good to go. So let's just put them side by side for a second. With general, you're asleep, your whole body is affected, and your muscles are totally relaxed. With local, you're awake, it's just one small spot, and there's zero muscle relaxation. They're two completely different tools for very, very different jobs. Okay, so we've got the whole body, and we've got one tiny spot. What about the middle ground? That's where our third category comes in, and it's called regional anesthesia. With regional, the idea is to numb out a whole section of your body. Think about your entire arm, or maybe everything from the waist down. The cool part is, the patient can stay awake for this, or if they'd rather be a little sleepy, they can get some light sedation. And doctors have a couple of really smart ways to do this. If it's a limb, like an arm or a leg, they can use what's called a nerve block. They inject the medicine right near the specific nerve bundle that controls that limb. For the whole lower body, they use spinal or epidural blocks, which target the nerve pathways right as they're coming out of the spinal cord. And here's a little something from behind the scenes. To make things sound a little less scary, doctors will often use simpler terms. A patient usually won't come out saying, "I got a spinal block." They're more likely to just describe it, saying, "Oh, I got an injection in my back that took care of all the pain from my C-section." And you can imagine, this has to be incredibly precise. For a spinal block, the injection is aimed at a tiny little space in your lower back, right between the third and fourth lumbar vertebrae. This is how they deliver the medicine safely and effectively right where it needs to go. All right, so the surgery itself is pain-free, awesome. But the job of anesthesia doesn't just stop when the surgeon puts down their tools. Its role can actually extend way into that super important recovery period.
Because you have to ask, right? The surgery's done, now what? What about the pain that's supposed to start after the main anesthetic wears off? How do you manage that without just relying on a ton of other pills?
Well, this is where that epidural we talked about becomes a total superstar. The anesthesiologist can actually leave a tiny, super flexible tube, called a catheter, in that same spot in the back. This acts like a little pipeline. delivering a continuous, low-dose drip of pain medicine right to the nerves.
And we're not talking about a few hours of relief. This continuous pain control can be kept going for up to 72 hours. That's 3 whole days. It covers that initial, really intense period of pain and gives your body a huge head start on healing.
And the ripple effects of that? They are huge. When your pain is under control, you just recover faster, period. You can get up and move around sooner, you don't need as many other pain meds, you spend less time in the hospital, and you get to go home to your own bed that much quicker. It is a total game changer.
So when you step back and look at the whole picture, from putting our entire body to sleep to just numbing a single nerve, it's clear our ability to control pain is getting more and more precise. And that makes you wonder, doesn't it? As this technology gets even better, what does it mean for the future of recovery? What new doors is it going to open for medicine?